Hello everyone, welcome to the Cardiac Wire show from RSNA 2024, and we're talking with Scott Galbari from Circle Cardiovascular Imaging about what's going on with Circle. So please start us off, tell us what's going on with Circle.
Yeah, well, thanks for having us. At Circle, we're well known for our roots in cardiac MRI. And so we're a company founded in 2007. We really leapfrogged ahead in the competition with regards to our solutions in the MRI space. We have focused on cardiovascular disease. So the thing we do is we're going to try to make sure that we have the best solutions for diagnosis and making treatment planning decisions for patients who have cardiovascular disease. And so we started with MR. We've over time introduced a lot of artificial intelligence, a lot of machine learning algorithms, and continue to improve our capabilities to make the process of diagnosis and treatment decisions much quicker for our end users who are going to be clinicians.
Is there any specific messages or conversations that you're having the most here at the show?
Yeah, that's a great question. I mean, we started with MR and we went ahead and added our CT package. So although we're well known in the MR space, we also have all of our cardiologist friends and our radiologist friends as well who are doing cardiac MRs and CTs. And we recognize, hey, it'd be great for them to be able to sit in one solution. And so we're bringing all of our expertise in artificial intelligence and machine learning that we've used on MRI studies and using them on CT. So, when we're talking to customers here, it's about one place that they can go and use a single solution for making these diagnosis and treatment planning decisions for their cardiovascular patients. Whether they're going through an MRI scanner or a CT scanner, they can use the best in breed AI technologies that we bring to bear.
Right. And I feel like every cardiac CT conversation that I've had here at the show, the new reimbursement comes up, and then conversations about how much more volume we're going to see in cardiac CT quickly ensues after that. Are you having these types of conversations with your clients, and how is the Circle Cardiovascular Imaging CT solution there to help with this added volume?
Yeah, that's a great question. Certainly every customer I've talked to talks about what's going on in CT, on the reimbursements, what is happening with some of the AI algorithms for plaque analysis that can be reimbursed, the things around FFR. So all of them are asking us what we're doing in that space. It's definitely got a lot of energy because it certainly gives you an opportunity to try to make decisions more quickly for patients and try to identify where there may be risk for patients. And it's much more cost effective. And if you can try to treat patients earlier, the likelihood you can maybe reverse it or at least slow it down is much greater. And so when we talk to all the cardiologists, radiologists that are coming into our booth, they're asking us about this. We're doing a lot around automatic plaque analysis. So we have the ability to go and find the stenosis throughout the vessels in an automated fashion, identify the types of plaque, calcified, non-calcified plaque, and then help them to understand really, hey, what is the disease state in any of the various vessels that their patients have.
Great, excellent foresight to expand into CT before all of this, and to build out a portfolio like that. What's next for cardiovascular or Circle Cardiovascular Imaging?
Yeah, I mean, for us, we're going to continue to improve our AI machine learning algorithms. Things like an MR where we have 40 flow. Or we look at quantitative perfusion, but things like 40 flow, they're big data sets, they're things that would normally take a long time. We're automating more and more of those activities. So we've done really well with historically these artificial intelligence and machine learning algorithms, and we continue to automate more of the process. And so whether it's in the case of MR or CT, we also do things like structural heart. So we're spending a lot of time on things like TAVR procedures, these sorts of interventional planning that can be done in our solutions. We try to automate as much of that as possible so we can help the clinicians get to the answers much more quickly. So we'll spend a lot of time and energy on how do we optimize the workflow, how do we make it more quick for the cardiologist or the radiologist to go ahead and get their work done, and to help them to be able to have more time to sit with their patients or maybe to see more patients.
Got it. Scott, thank you so much. Congratulations on all you're doing, and best of luck with the rest of the show.
Thanks, it's a pleasure.